Good afternoon and welcome to Infectious Disease Grand Rounds. There is no commercial support for today's program. Any financial relationships of the planners and speakers with commercial interests has been mitigated. If you have a question for our presenters today, please hold until the Q&A segment at the end of the talk. And if you're attending virtually and have a question, please enter it into the Q&A section. A link to the event survey will be shared at the end of the program. It is now my pleasure to introduce Dr. Supriya Mannepalli, Medical Director, Infection Prevention and Control.
Thank you, Jennifer. Thank you, everyone, for attending the ID Grand Rounds today. So we'll be talking about vaccinations, having crucial conversations, and we'll attempt to debunk some myths. I am very thankful for our panelists today. So the way we're going to do this, I'm going to go over some of the historical perspectives, and then we'll invite our panel members, Dr. Ramanpreet Dhindsa, Dr. Christopher Kiker, Dr. Alix Schnibben, to do a Q&A with some of the common myths, and we'll make an attempt to debunk the myths. So the only disclosures here are that we are biased towards science and evidence-based practices, myself and the panel members, and Dr. Schnibben is on the Speakers Bureau for GSK Vaccines. I think starting off with historical perspectives, the concept of vaccination is not new. This goes back all the way to 400 BC, where they really attempted, what they tried to do is, they call it variolation, where they took the dried scabs from people who have had smallpox and are recovering, and then injected that to the healthy people, hoping that that would actually protect them from getting smallpox. So basically, exposure leads to immunity, kind of the building blocks of the modern day vaccines. And this goes back again to many, many centuries ago. And then, of course, in 1700s, Edward Jenner and his work on the smallpox vaccine, then came the germ theory. Thankfully, we don't see this these days. This is a picture from the days of polio. This was not uncommon to see patients in these large wards with iron lungs. This is basically a large airtight seal with negative pressure for those patients with respiratory paralysis to help them breathe. The people who have actually lived in these for their entire lives, or some of them stayed in these for years to weeks. This is not even an entire list. So from 1700s, we have several vaccinations available to children, adults, even in the agriculture industry. I don't think, thankfully, we don't associate July 4th or call it the Tetanus Day because of the vaccines that we have now to protect us from. Otherwise, tetanus was very common after the July 4th fireworks. And this is a paper from 1935. And smallpox. Again, thankfully, we don't see these infections now because of the work that has been done and the vaccines we have available. Because if you look at infections like smallpox, the mortality for certain types of smallpox was even up to 100%, the hemorrhagic type. Otherwise, the mortality was as high as 30%. And then, of course, came the mass vaccination programs that started in 1800s in schools, especially, again, first with the smallpox vaccine, and then expanded to other vaccines as they became available. And then, of course, we've been successful in eradicating smallpox by 1979. And the next few graphs really show us the decline in the rates of some of these vaccine-preventable illnesses or infections, and they all speak for themselves. If you look at the tetanus deaths post-implementation of the vaccine program, again, a sharp decline. We do see some cases on and off, but that's in those who are not up to date with the tetanus toxoid vaccine, but otherwise very rare. And again, looking at the polio, other than I think 2 countries, when I was researching for this talk, Afghanistan and Pakistan, pretty much we have eradicated polio except for those 2 geographic areas. And again, if you look at the infant mortality, studies show that infant mortality vaccines have contributed to decreasing the infant mortality by up to 40%, and in Africa up to 56%. And a lot of these are again, if you look at the sharp decline in measles cases, we are seeing an uptick recently, again, in communities where there is no herd immunity. Again, decline in infant mortality over years, and the gray line actually shows what it would have been without the vaccines. Again, childhood vaccines over years have saved millions of lives and continue to do so. And even in the adults, prevent hospitalizations and mortality, especially in those who are high risk. If you look at the HPV vaccine and cervical cancer-related deaths in women under 25, again, we're seeing a decline. This is over the last 30 years. And I think it's very important to see that the vaccines not only are preventing infections, but also, again, helping decrease the rates of cervical cancer-related deaths in women. And the most recent one, I think all of us have experienced, is COVID-19, how quickly the vaccine was available. And the estimates are anywhere between 1.5 to 4 million deaths, on average 2.5 million deaths averted because of the availability of the vaccination. And the benefits of vaccination in adults, again, 22% reduction in all-cause mortality in adults with cardiovascular disease from pneumococcal infection, and 50% reduction in risk of illness, again, from flu. Even if, again, they look at the match, but even in the years where it's not a perfect match, there is still some protection the vaccine offers, and especially prevents the risk of severe infection, pneumonia, hospitalization, mortality for those high risk of developing that with flu. And hepatitis B, we have seen a significant decline in hepatitis B cases, not just in adults, but also in infants, and decreased mortality from liver cancer because of that. And again, decreased, the most recent zoster vaccine, the recombinant vaccine, is so effective that decreases prevents not just the shingles, but also the post-herpetic neuralgia from that. So, okay, why again, okay, we're decreasing the number of infections, but again, that is directly correlates or has an impact on our economic cost as well, that when we are decreasing the infections, we are decreasing the economic burden on the society as well. So the benefits of vaccine go beyond just decreasing infections, decreasing hospitalizations, but directly are associated with financial economic benefits as well, that go into billions of dollars. And this is just information where in the last 50 years, number of infections from vaccine preventable illnesses that have been averted, 508 million, decreased or prevented 32 million hospitalizations and 1+ million deaths. Again, I would exclude COVID here. Again, if we had COVID, that would be higher. And again, speaking of vaccines beyond humans, even in the animal industry and the dogs, the rabies cases, you see that sharp decline over years after the mass vaccination of dogs against rabies started. So again, this is over years and decades of data, and even centuries for some vaccines like smallpox. So why are we talking about vaccines today? Whether he made this quote or not, William Stewart, who was the Surgeon General of US 1965 to 69, I think, that he said that he was a big proponent of public health. Not just about infections, but also chronic diseases, heart disease, diabetes, smoking. And this statement is quoted by a lot of ID docs many, many times. And he said, or whether he said it or not, it's attributed to him, it's time to close the book on infectious diseases, declare the war against pestilence one, and shift natural resources to such diseases or chronic problems like cancer, heart disease. And he also, again, they say that he made another statement where he said the ID fellows in training probably will have to spend time swabbing each other because they will not have any work to do because we are eradicating all the infections. So current state, again, talked about herd immunity. If you look at infections like measles that are extremely contagious, one measles patient can infect up to 18 others. We really want to be above 95% of vaccinations in the community to protect those who are not yet eligible to get the vaccine or who cannot get it due to contraindications. We're seeing a drop in that. For some others, the herd immunity is somewhere close to upper 88 or 86%, and we are slowly seeing that creeping down. When that goes down, we are not able to protect those who are not eligible yet to get the vaccinations. And there are increasing requests for exemptions, non-medical and medical exemptions as well. And those of us in front lines, we are talking to our patients' families on a regular basis, trying to raise awareness and educate them. And these conversations are extremely important because we're seeing a surge in vaccine-preventable diseases again. Whether we take purchases, again, we have seen, at least here locally, a couple of cases of tetanus. Of course, measles has been all over the news. So again, it's extremely important that we continue to have those conversations and talk to our patients and family members about this. And that's what we're going to do for most of the talk today. This is just a graph showing the spike in the measles cases last year and this year. And now we'll be moving to debunking the myths. This is the history, this is the foundation of why, again, the why behind this talk today. And I would like to invite our panel members, Dr. Schnibben, Dr. Ramanpreet Dhindsa, and Dr. Christopher Kiker. Thank you so much. Dr. Dhindsa is our chair of pediatrics here at NGHS, and Dr. Kiker is one of our family medicine physicians, and Dr. Schnibben is the director for the ambulatory pharmacy and quality. We'll try to keep it as informal as possible, but we'll see how this goes. We're attempting a new format. I will read the question, and then I will ask one of the panel members to chime in, and then any the others as well, feel free to chime in, please. So, first question. I grew up with a background in integrative healthcare, and I have personally seen patients who had severe changes after vaccination. Kids who were healthy and regressed or became chronically ill almost overnight. I know those experiences are not scientific evidence on their own, but they shaped my perspective and why I am cautious. Dr. Kiker, when you hear this in your practice, how do you address this?
Yeah, so I actually copied this from a note a patient sent. The mom, young mom, really smart, and has 4 kids, all under the age of 8. Came in over the weekend, went to urgent care. Long story short, the whole family got diagnosed with whooping cough. And as a good family medicine doctor, I sent her a message probably Monday or Tuesday when I saw it. And this was the response I got. So big picture, I'm a big picture person. We can get into the details. You can Google the details. But big picture, the way I tackle any conversation like this, and I'm still learning myself, but kind of keep 3 big things in my mind. Number 1, vaccine hesitancy is a spectrum. You've got people on one side that are gonna take everything you give them, no questions asked, trust your doctor, thank you, and they're gone. And then on the other end of the spectrum, you've got people that aren't taking anything, no matter what you do. And quite frankly, though, if you classify those people in your mind, you can save yourself a lot of time. But there's a lot of people in the middle, and the people in the middle are the ones that we can shift. And it's valuable to use our time, use our resources to have these conversations. And so the next thing to think about when answering this question is try not to let a disagreement ruin your patient relationship. And that's kind of, I'm always thinking that in my mind, like, am I losing this patient relationship? Is this, are we having too much back and forth? So nothing's worth losing a patient relationship in my mind. And then ultimately, all parents and all patients, they want what's best for them and then what's best for their kids. And ultimately that's what we want as doctors. So if you meet people on that common ground, you can have a good discussion and shift those people in the middle. So with this specific patient, I think my response was, I don't know if that was my response or not. That wasn't my response, but there's a good response. You can read it on your own. But basically, I replied, wanted the patient to know I hear her concerns, I value her background, and just left it open for if you have any questions or concerns, would love to talk to you further in detail. I saw her a couple weeks later in the office. We had a cordial conversation. Her kids were better. Thank goodness that pertussis hasn't gotten smart and still responds to azithromycin for right now. But yeah, so I tackled this question. I hear you. Open-ended questions. I'm here if you want to talk or have any further questions. So on the slide, you have some specifics.
I think that's very important that can have those, acknowledge their concerns, have the discussion, and keep them in your practice and can keep that relationship going so you can continue to educate and counsel them. Anything else from any of the other panel members about this? Okay, we'll move on to the next question. Do vaccines contain thimerosal? Dr. Schnibben?
Yeah, absolutely. I think this question was put to bed, I feel like, for a very long time, and it's now woken up again and is traveling around the United States as a topic of conversation with the transition of those that are on ACIP now. So it is a hot topic that comes around in conversation in clinic a lot. But from pediatric vaccines in 2001, it was removed from all pediatric vaccines. There are some vaccines such as MMR, varicella, polio, and pneumococcal that have never contained it. Multi-dose vaccinations have to have an ability to be protective and not have contaminants in it due to the multi-dose function, but you do have the ability to get multi-dose vaccinations just as single-dose syringes, which means they are going to be preservative-free. So they're all alternatives if that is a concern for a patient. There has been no causal relationship found between that as well as autism. So again, going back to taking that time, hearing the patient, listening to them, and responding in a way that's empathetic but contains evidence for the patient to realize that it's still okay to vaccinate, and in pediatric patients, our vaccines don't contain it. So hopefully that'll help them make the decisions.
Thank you. Thank you. Next, Smith, I had a question we received. I had a friend whose infant died after he got vaccines. Do vaccines cause sudden infant death syndrome? Dr. Dhindsa?
Thank you, Supriya. Now, in today's age and time, all parents have a lot of access to internet, and when you see a parent read this online saying vaccines are related to sudden infant death syndrome, it is reasonable for them to have this provoked a lot of anxiety in the parents. So the good thing is that major global societies around the world have come to a conclusion that there is no causal relationship whatsoever of sudden death syndrome with vaccines. The misconception basically stemmed from the time that there's a coincidence between the sudden death syndrome, the timing of the sudden death syndrome, and the vaccination. So the peak of incidence of sudden death syndrome also happens to be around 1 to 4 months of age, and the initial vaccination in an infant is given at the same time around 2 months of age. Fortunately, around 2000s, it was found that there was a steep decline in the sudden infant death syndrome. And this was related to the introduction of Back to Sleep campaign. So it clearly shows that there is no correlation between the vaccine and the sudden infant death syndrome. And also, the research proved that the sudden infant death syndrome is related to environmental and physiological causes. Placing the baby on the back, not having any loose materials, not getting exposed to smoke exposure, and then also abnormalities in the brainstem that cause inhibition for the baby to wake up are the major causes for sudden infant death syndrome. So vaccines are not related to sudden infant death syndrome.
Thank you. I heard from my uncle vaccines cause autism. Is that true? And other question kind of along. I have 4 kids. The 2 that got vaccinated as children have autism. The 2 that are not vaccinated do not have autism. You can't talk me into vaccines. Dr. Kiker?
Yeah, so the second one was also another patient I had in clinic, a mom that I've built a great relationship with, taking care of her family, and her 2 oldest have severe autism. They're nonverbal. That was an interesting day. I took an ingrown toenail off of the oldest. That was a fun in-office procedure with a nonverbal kid with autism, but we got him taken care of. But side note, but that was a tough conversation. How do you convince a mom that has 2 older kids with severe autism that got vaccinated, and then she has younger kids that she didn't do vaccines on, and they don't have autism. So I basically presented the stuff. She's smart. I gave her the studies. I said, hey, read these over. Next time you come in, let's talk about them. In primary care, I have the benefit of seeing patients again and having that relationship long-term. So, that day I knew we weren't going to get to a conclusion, but she actually did look at the stuff and the information I gave her, and it's all listed here under the evidence, but she still doesn't vaccinate her youngest kids, and I kind of put her in that box of someone that I don't know if I'm going to ever be able to move the needle, but we have great evidence. We all know it. We can recite it. We've looked it up as we've had those conversations about autism and vaccines. But there's a huge question mark about autism and the vaccines causing it, causation is, correlation is not always causation. So this is a tough one. I think there's still science to be done on the autism and, as a disease and what causes it. As I look at myself, in high school and growing up, I don't remember a whole lot of kids with autism, and now there seems to be a growing number. What causes it, I don't know. I'm pretty convinced that vaccines aren't causing it, and vaccines are safe. That's still going to be my parting line in the clinic with patients, that vaccines, the benefits of them outweigh any risk that it may cause autism or any other disease process. So I think as outpatient doctors, as family doctors, as inpatient doctors, advocates of vaccines, and continuing to hope that folks will listen to us.
Thank you, Dr. Kiker. I actually went back and found that study from 1998 by Andrew Wakefield and colleagues that was published in Lancet. And so there were 12 other authors for this study, and that's the one that suggested MMR vaccine may predispose to behavioral regression and pervasive developmental disorder in childhood. The sample size was 12. It was an uncontrolled design. The conclusions were of speculative nature. The fact that the timeline of the MMR vaccine and the diagnosis of autism, both events occur in early childhood. So the temporal relationship is kind of predestined. And as you see on this slide, there was a large Danish study that failed to conclude any correlation. And following this, 10 of the 12 co-authors retracted from the study, from it. No causal link was established as data was insufficient. There were financial interest because Wakefield paper was funded by lawyers who had been engaged by parents in lawsuit against vaccine-producing companies. Lancet completely retracted the paper in 2010. Retraction was published in a small anonymous paragraph in the journal. And Wakefield et al. Were found guilty of ethical violations because sampling was selective and there were ethical violations in how the data was presented and published. But the damage was done because several organizations, scientists have spent a great deal of time and money refuting the results of a minor paper in Lancet with a sample size of 12 and exposing the scientific fraud that formed on the basis of this paper. And again, as of now, we don't have any study confirming a causal relationship. And I think it's very important, that's why for those who are involved in research, to keep that ethical responsibility and integrity when they do research and submit manuscripts. So again, this study keeps quoted all the time, even though it's a retracted paper. So I just wanted to at least present this information here. So next question, why do I get the flu shot and still get the flu? I've gotten sick from getting the flu shot before. Why would I continue getting the vaccine? Hello, sir. As you know, my wife and I are going to start fostering, and since we both have a medical background and we will be getting medically fragile children, DFACS is wanting us to have flu shots. The last and only time I received flu shot was in 26, and I ended up with the flu 5 different times in 4 months. Is there a way I could get something from you saying, due to reactions, I don't need this shot? I really don't want to have to deal with that again. Again, we do hear that often. I got a vaccine and I got the infection, especially with the flu shot. As the vaccines are building the immunity, we may experience some fever, myalgia, some headache post-vaccine for 2-3 days, and that is not from the infection. And most of the vaccines we use for flu now are inactivated. There is one live vaccine, the nasal spray vaccine, which contains the weakened version of the virus, so it really cannot cause influenza illness. And these symptoms that may be attributed to flu or really the normal immune response. And the most important thing, again, is, of course, we all know that even if the vaccine is a mismatch, and if someone gets the infection, it's very important. The vaccine does offer some protection. Like this year, I think I'm monitoring the data because there was some early study from Japan and UK that shows that the vaccine may not be the perfect match. I think it's still recommended to get the vaccination because vaccine does prevent severity of the illness, does prevent hospitalizations, does prevent mortality. So again, vaccine does not cause flu. So very important to again, talk to your patients about that and educate them and encourage them to get the vaccination. Okay, I'm going to the next question. Let me go. Okay, next one. Do I need to get the RSV vaccine every year, Dr. Schnibben?
Yeah, absolutely. I think to clarify here, when you hear RSV vaccine, that is the adult vaccination. If it's RSV monoclonal, that is the pediatric monoclonal antibody for RSV prevention in pediatric patients before in their first or second season, depending on their risk factors. So the recommendation for your pediatric population is going to be much different from the recommendation for your adult population. So there are those monoclonals that can help prevent RSV in our pediatric patients from their first season or their second season, depending on their risk factors. Now, for an adult, it gets a little bit different. So you have your maternal vaccine that's from 32 weeks to 36 weeks. That's a really in-depth shared decision-making conversation between our OBs. Challenge, if you're an OB provider, be up to date on that vaccination and understand how to also have the conversation about the pediatric monoclonal, because if the maternal mom, gets the vaccination, their child is now disqualified from the monoclonal. Data is very different between the two. If you have to have that conversation, it's really important to know for the monoclonal for your pediatric population, it has longer action. It lasts 6 months. Maternal is about 90 days for that, and there's less side effects to the infant than the maternal vaccine to the mom and the baby. So it's really important that you know the data that's there and around the studies for that one. Now, for the adult vaccination outside of maternal, there is a high-risk population, so those that are 50 to 74 years of age with high-risk conditions. So things we commonly think about, heart conditions, which is really interesting, diabetes, has to be diabetes with complications, or on a SGLT2 or insulin. And then other things like nursing home, obesity. If a patient lives in a rural area, that also qualifies them. They can be completely healthy, but live in a rural area and be 65, and they can get it early. Or it's the age-based recommendation of 75 years and older. So stay up to date on that one because it's probably going to change again when they vote in February.
Thank you. Thank you, Alex. The one thing I think as I was preparing for this talk that surprised me is the very, very low intake of the maternal RSV vaccine, especially for Georgia, 35 to 40%. So it's recommended for those who are pregnant, 32 to 36 weeks, September to Jan months. It especially protects the baby, but the intake has been very low. Again, it's something I hope that we see an increase in the uptake of this vaccination because it does protect the babies, especially in that first 6 months of the life. So anything else, Dr. Dhindsa?
So one thing that Dr. Mannepalli just said, that how if the mother takes it, its effectiveness on the baby in the initial months when the baby is very vulnerable to contracting RSV and possible hospitalization in most cases, it showed, the clinical trials showed that there's a reduction of 68% if the mom has received a vaccine. So that's really high amount, I think. I wish our community, starts buying into this vaccine more. The rate of reduction, overall reduction in 0 to 7 months, if they've received the RSV vaccine for the babies, this data is from the pre-COVID days to in 2020, before 2020, and then if we make a comparison between then to 2025, the rate of hospitalizations have dropped to about 28 to 40% in the neonates. So that's tremendous again.
Thank you. Dr. Kiker?
Yeah, and I don't know if there's another spot to bring this up in the PowerPoint, but an angle I've taken in the clinic and seem to have some success, especially with my older patients in the vaccine conversation, is bringing up that sometimes we get the vaccines for others, and for the most vulnerable in the population, the babies, the folks with comorbidities, lots of comorbidities, the old and the frail. So I've recently started bringing up that angle, if you will, and it actually takes a lot of traction. And you don't, in the vaccine conversation on TV and news, you're not going to hear people talk about, hey, we get this for other people. And I think that empathy piece that you pull out of people can be a topic of conversation.
Thank you. Thank you. Yeah, I really hope we see an increased uptake among the pregnant women, especially of the RSV, and of course in our elderly and most vulnerable. Do vaccines contain live viruses? Dr. Dhindsa?
Now, when this statement, do all vaccines contain live viruses, is false. Now, some of the vaccines do contain viruses, but those viruses are live attenuated viruses, or in other words, you can say they are the weakened viruses. And they're not capable of causing an active disease in a healthy person. And there are different forms that you can make the vaccines, like live attenuated viruses, inactivated viruses. In inactivated viruses, you do have the whole bacteria or the virus in the vaccine, but they are dead viruses, so they don't end up causing any kind of disease, active disease in a human again. The other viruses, for example, like the subunit and the recombinant and the conjugate vaccines, they contain specific pieces of the viruses and germs, and they do not contain live viruses. Again, the myth that it causes a live disease cannot happen with these viruses. So to answer this question, do vaccines contain viruses? Yes, they do contain, but they are not capable of causing an active disease. And also the fact that the viruses can, the recombinant viruses or the mRNA viruses, they are live viruses and can incorporate into the nucleus is also not true. So these viruses are there in the vaccine but do not cause active disease in a human.
Thank you. Anything else from any other panel members? No? Okay, we'll move to the next question. Do vaccines contain microchips or other tracking devices? I had to add this. Alix?
No.
Yeah, Dr. Schnibben, that's for you.
Full answer, no.
Move on to the next question. Yeah. So yes, again, vaccines, the way they're manufactured, produced, again, there are several agencies that are monitoring the production, of the vaccines, and CDC, FDA, WHO, all of them have confirmed there are no microchips or tracking devices in vaccines. Okay. Do vaccines contain animal products? Dr. Schnibben?
So this is a question that, when people think about their moral and ethical values, this is something that can come up in topics of conversation. So what's important to know is that some vaccines do involve animal products in their manufacturing processes. We have to be able to take components in order to stabilize and grow what we need to create the vaccination. So some of these products, such as gelatin, amino acid enzymes, and sermin, are used as that growth medium. But very low rates of this will actually transfer over into the vaccine. So for example, gelatin, bovine, for example, are used to stabilize the vaccines. Egg proteins are used to grow some of the influenza vaccines, but you can get mammalian-based cell-derived flu vaccines as well. Those would be the cell-cultured vaccines. There are practices put in place to make sure these are safely regulated. All vaccine components are fully published, and you can pull their full ingredients list if someone was very interested in that. But we have to be able to create vaccines. So because it needs to be created, you have to have that growth medium. It is severely regulated by the FDA, and it has to be fully visible what is used in that manufacturing process. So it's very easy to find, but it is necessary for the vaccination to be prepared and made in order for us to give it. So just part of the process, but does not stay around in large quantities to affect us in any way.
Thank you, Dr. Schnibben. I think one of the things also for those that do not want, even if after all of this counseling, if they still have some hesitation, especially for MMR, certain other vaccines, there are gelatin-free alternatives that you can talk to your provider about. And regarding fetal cells, I know that question comes up as well. I don't know if I have a separate question on that, or do you want to tell? Okay, yeah, so we'll get to that when we, so again, with animal products, again, while they do, I think it's very important, as Alex said, that we counsel our patients and encourage them to get the vaccinations. Does mRNA affect my DNA permanently? I think this question came about a lot during the COVID vaccinations, and no, it does not. It doesn't even enter the nucleus of the cell, stays in the cytoplasm and instructs the cells to produce the protein that codes for the mRNA, and it pretty much disintegrates very quickly, doesn't stay in the body, so there has been no proof as of now or evidence to, and again, shared by multiple regulatory agencies, that there is no concern that there is any residual DNA that is going to alter our DNA. So again, no data to support that because it gets disintegrated pretty quickly. It does not integrate into our genome or alter the genetic code. Vaccines contain human cell lines, which is against my religion. Dr. Schnibben?
Yeah, absolutely. This came up a lot during the COVID vaccine process. We published a lot of information out to our communities about this. So several vaccines, but not all vaccines, do involve some cell lines that came from 2 elective abortions in the 1960s. There has been no new fetal cells gathered in order to do any type of vaccine studying, development. It's only from those 2 elective abortions. There's no fetal cells in the final product that is given. But what's important to know is, again, for the development, we need cell-based cultures sometimes to do that, and they are sometimes used, but there are some vaccines that don't use the fetal cells at all, those being influenza, HPV, and meningococcal, to name 2. We'll name 3 if I could count today. But it's also important to realize that the religious organizations such as the Vatican do say that if there is no other alternative, that is appropriate for patients to receive those vaccinations, because the ultimate goal of vaccination is protection of life. So they do agree that you can get it, but if there is an alternative that doesn't involve that, they do recommend that first.
Thank you for sharing that. And the reason why these lab-derived fetal cells, I think most common of the fibroblast cells, are used because they're not infected, they're not been exposed to any viruses, and the vaccines produced in these cells would not be contaminated, of course, or exposed to any other viruses. That's why those cell lineages that are lab-derived are used. And as Dr. Schnibben said, a lot of religious organizations, religious leaders, Catholic Church have addressed this, stating that the use of vaccines is morally acceptable or even a moral responsibility when no alternatives exist due to remote connection of the original act and public health benefits as well. The number of vaccines on today's vaccine schedule are way too many for my young child's immune system to handle. Dr. Kiker?
I feel like you're better
I think
prepared
both of you
than
can
me.
chime in, yeah.
Well, yeah, so people say this in clinic when they're talking about altering the vaccine schedule for their kids. I forget the specifics, but there's, the way I would tackle this with a patient would say, well, tell me what your concerns are about that, and try to get specifics, see where they're coming from, see where their information's coming from, and then I would come back and say, well, the vaccine schedules well-studied. Immune systems of babies and kids are very robust, dealing with thousands of different antigens daily. And I made up thousands. There's 165 there. Okay, that's for the vaccines, but yeah, the immune systems are robust. They can handle it. It's well-studied. And then from a population health standpoint, there needs to be a schedule so that we can vaccine all of society and have a good way to roll that out within our health system. And so ultimately, that's where the vaccine schedule comes from. And I do have some parents that want to do delayed vaccines, and we'll counsel them, but ultimately, as long as we can get them the vaccines, I'm okay with that. So that's my clinical answer.
Dr. Dhindsa, do you have anything?
So to answer this question, when the babies are born to the mothers, they carry passive immunity from the mothers. They're covered for the initial few months, and the immunity then wanes off. Vaccines are scheduled, and they're timed to start at this time so that the infants can build their own active immunity in the most vulnerable period, because the peak of vulnerability for these infants is around the time when this immunity is waning from their mom. Infants and young children, they have the developing immune system, and they're prone to or susceptible to contracting diseases that can cause major side effects, and those can only cause minor symptoms in an adult who's immunized. The other question that usually follows, like Dr. Kiker said, that there are too many vaccines that are given at once to my child. And as he answered, every day the babies are exposed to thousands of antigens when they're playing naturally in our environment, going out, eating at a restaurant. And the vaccines actually, if you are giving all the vaccines under 2 years of age, the infant is exposed to only 167 to 180 antigens, which is negligible in consideration when you're comparing it to the natural antigens that they're exposed to. Another question, like Dr. Kiker also mentioned, is risk of delaying. Yes, we are going to be okay as healthcare providers as long as our patient population agrees to vaccinate, but it is not recommended to delay the vaccinations because it leaves the kids during that vulnerable period unprotected and at a higher risk of developing the infections that can be easily prevented with the vaccines.
Thank you. It is better for my child to develop natural immunity by attending a measles party than get measles vaccine. Dr. Dhindsa.
So yes, by attending measles party, your child will develop natural immunity against the disease, but it also accompanies with a lot of risk factors and dangers that can be easily avoided with the vaccine. Vaccines, when you give a measles vaccine, you give a controlled immunity to an infant. Unlike natural infections where the viral load is uncontrolled, the outcomes are unpredictable. Vaccines provide robust, lifelong immunity when given at right time. There are dangers of natural immunity that accompanies when you attend a measles party. The studies show that 1 in every 4 of these patients get hospitalized. 1 in 10 will develop encephalitis or brain swelling, which can lead to permanent brain damage. And you even have detrimental outcomes like death with these side effects from measles. Rare but long-term complications like subacute sclerosing panencephalitis, which is a degenerating neurological disorder, can also happen. And this actually happens 7 to 10 years after the initial disease has resolved. And then also this accompanies along with immune amnesia. So basically your body was capable of fighting with these infections previously and now cannot fight with them. Measles itself is actually a live attenuated vaccine like we spoke about before. And with these live attenuated vaccines, if you give 1 or 2 doses, this provides lifelong immunity for the person. And before this vaccine came out in 1963, 3 to 4 million people were contracting measles every year, resulting in 400 to 500 deaths and 48,000 hospitalizations. And it became eliminated, it was eliminated in US, considered eliminated in 2000s. Now we do have sporadic measles outbreaks, and it happens in the communities where there's unvaccinated population most of the time.
Thank you. I think that's the key, that when we are trying to get the infection, we can control the cascade of events that could result in encephalitis, permanent disabilities, death, meningitis. So again, vaccines are much safer way to get the immunity.
And people have,
Oh, is it not working?
and people have emotional responses from what they've seen and experienced. And I think a lot of times we're here because measles has been gone a long time and no one has experienced the death of torch illnesses. I have a friend and colleague, retired physician, and talking to him about taking care of babies before we had vaccines was pretty eye-opening. It had a lot of infant deaths, and he was a part of it. So, our patients really haven't seen, besides COVID, what these small things we can't see can do to the population. And so until patients see it and have that emotional response, it's up to us to communicate that to them, and so that can help guide the conversation.
I think that's very important. Thank you. Yes. Vaccines are part of global conspiracy. I didn't assign it to any of the panel members, and each of you can kind of say what you want, anything you want to share.
They're not part of
No,
a global
the
conspiracy.
answer is a big no.
They're
At
part
least
of a
we don't have
global
evidence.
initiative to have a
Yeah.
population.
Yeah. Yeah.
And I think, again, big picture, I think the media and powers that be want us to not like each other and hate each other, and for whatever reason, there is a big disconnect between what I think will move society forward in vaccines, and then there's a lot of myths out there, and I think it's ultimately our job to find those people in the middle that we can have those conversations with. And goodness, they're exhausting. I think we can all look at each other and be like, man, I'm tired of having these conversations with people I really don't want to have them with, and you're just stuck in your job as a doctor. And it's our job ultimately to have these conversations, move science forward, be advocates of evidence-based medicine, and I hope that everyone watching will continue to wake up every morning and have some energy, drink some coffee, and tread forward.
I think it's very important, as you said, to keep having these conversations, because the only thing we have evidence for is the number of infections prevented, number of deaths prevented, and how many lives vaccines have saved over years. There is no other global conspiracy or hidden agenda behind the vaccination program. Next is vaccines are full of harmful toxins like antifreeze, mercury, formaldehyde. Dr. Schnibben?
Yeah, absolutely. This is a common question. So let's put it out there. It doesn't contain antifreeze at all, not part of the manufacturing process. It gets confused with the polyethylene glycol, which we know is part of a lot of processes across medicine, as well as food processing. So it's really important for people to understand that that's a common misconception about antifreeze. We've kind of already talked about mercury, formaldehyde is part of deactivating the virus and the toxins. It's actually presented less in the vaccine that actually naturally occurs in our body. It's important to know that these things naturally occur in the environment in small amounts in our food, our water, and in our own bodies. Extensive research has been done to know that these things are safe to use in the manufacturing process and safe to expose our body to, but there is no antifreeze. Let's put that on the table. No antifreeze.
Thank you. Next, why do babies need hepatitis B when mom is negative and baby is not having sex or using drugs? Dr. Kiker?
Yeah, so Ultimately, the big picture conversation with this with a mom is hepatitis B, babies are at risk for getting it from contact that we can't even see, saliva, fluid, and vaccinating the baby prevents them from any kind of contact. And so, and a really, I think it's a 2-part vaccine. No, it's a 1-part vaccine.
I think the big thing with the hepatitis B virus, even with our blood-borne pathogen, is that's the one that can stay in the dried blood longer, even up to a week. So the baby can get that just from that contact with that, and they may not even know. And I think that's why we should start vaccinating the babies right away instead of waiting. And again, very, very important because the data shows that the hepatitis B vaccines have decreased by 95% in infants since the vaccination program has started. So, yeah, so again, very important to talk to them about the why behind this and counsel them to get the vaccination or give the vaccine to the baby. My child already had cold this winter, that was flu, I'm sure, so I don't want to get the flu vaccine. Dr. Dhindsa?
This is a very common question that you encounter every day in clinic and hospitals. So obviously all of us know that every common cold is not caused by influenza. Common colds are basically caused by normal viruses like common viruses like rhinovirus, enterovirus, paraflu. The only way that you can test that the baby really has influenza is by doing the nasal swab. And after that, if you even find that the baby's had flu A or flu B, yes, the natural immunity will be there against the particular strain of influenza that the baby has now, but that does not cover the other strain. So your baby will possibly have, could have infection from the other strain of influenza that's circulating in this region.
Thank you. I think we have 6 minutes, and I think we have 7 or 8 questions, so we'll do like short answers because I want us to get through all the questions that we have. So, and some of them we may have already touched on, so let's see. Dr. Schnibben, this is for you. I have a allergy. I cannot take the flu vaccine.
Yeah, so 2 flu seasons ago, the ACIP reviewed the data and removed the commonality of if you have the egg allergy, you can't get it. So anybody is eligible to get a flu vaccination regardless if it's grown in eggs or not. So it increased the access to the vaccine. Doesn't even have to be given where a patient has to be medically monitored. It can be done at any site that's able to handle an anaphylactic reaction. And there are egg-free options available, Flucellovax and Fluvox, if a patient is really concerned about it.
So egg allergy is not a contraindication to get the flu. They can still get the flu vaccine. Thank you. Vaccines are more dangerous than infection. We touched on this, so I'm going to skip this one if the panel is okay. Yeah. I heard vaccines can cause cancer, so I do not want to get the vaccines. Dr. Kiker?
Yeah, it doesn't.
Yeah, if anything, it has helped decrease the rates of cervical cancer, liver cancer, especially with our Hep B and HPV vaccinations. Yeah. Infants and toddlers are being vaccinated too early. Dr. Dhindsa?
I think we covered this.
Yeah, I think so too, yeah. Okay, let's, I'm planning to have children soon, and I do not want to get flu vaccine or any other vaccines. I'm pregnant now, and I do not want to get the flu vaccine as it can cause genetic defects in my baby. Pregnant women are at high risk of having severe infections from flu and actually requiring hospitalization. One of the cases of flu I saw here years ago was someone who ended up on ECMO from a flu infection. We had to deliver the baby prematurely. So very important to take your time to counsel those who are pregnant to get the vaccination because it also helps protect the baby. Babies can get it for up to 6 months after birth. So they also have the immunity from the mom. Vaccines remain in body lifelong and cause long-term side effects. Dr. Schnibben?
The vaccine doesn't stay in the body long. It breaks down within days and weeks. It its job is to cause that immune response so that it remains in the body through a immune memory, not the vaccine itself.
Vaccines cause infertility, so I do not want to get the vaccines. Dr. Schnibben?
The vaccines do not cause infertility. This was studied extensively during the COVID vaccine time period, but has come out a lot in research and through the CDC that they did not cause infertility.
Those associations like ACOG actually affirm that vaccines do not cause or impair the ability to conceive. So again, very important to take time to talk to our patients and educate them about this, about the safety of vaccines, if they're planning to get pregnant or if they're pregnant. Vaccines increase the risk of allergies. Dr. Kiker?
Yeah, not true unless you have that patient with 40 or 50 allergies and you're like, I don't want to deal with a phone call. Joking. But yeah, vaccines don't increase your risk of allergies. And there's a lot of science behind it.
I think the rise in the allergies over recent decades is probably from all this hygiene hypothesis that, our kids are exposed to less microbes early on, and then, of course, our environmental changes in lifestyle and not necessarily the vaccines. I do not need my child to get the vaccine as all the others around them are immune. Dr. Dhindsa?
So herd immunity to protect an unvaccinated child is a dangerous approach. The purpose of herd immunity is to provide protection, like a protective shield for the most vulnerable ones, or the ones that are incapable or for legitimate medical reasons cannot take vaccines, like newborns, pregnant mothers, immunocompromised patients, patients receiving chemotherapy. So it is not a substitute for vaccine. An unvaccinated child, even in a herd immunity, becomes a host and is capable of transmitting the disease and spreading the disease, and sometimes even to these vulnerable patients that are not capable of taking the vaccines. This has been proven by outbreaks that still happen in our communities. For example, measles. The threshold for some of these diseases like measles is so high for herd immunity. It's 95%. So when we don't meet these thresholds, our outbreaks happen, and these outbreaks seem to happen almost always in an unvaccinated community, people over there. So herd immunity is not a substitute for not giving vaccine to your child.
Thank you. Okay, last one is assigned to me. As long as I wash hands, I don't need to get vaccines. Hand washing is important, but it cannot replace vaccines. It does decrease the risk of transmission of pathogens from contaminated hands to others, and very important infection prevention strategy. But pathogens are spread by air, droplets, contact, and vaccines also help herd immunity, as our panel has said, in protecting those vulnerable babies, children, adults that cannot get the vaccine due to age or contraindication. So they go hand in hand. So both are extremely very important infection control strategies. This is our last question, and I think it's 1 o'clock, so I think that's kind of, if we have any questions, I don't know if we have time, but we'll be here and we can take some questions if you have any. Thank you for attending.
Let's take a few minutes here, maybe just 1 or 2 questions. I do have a comment from online, Dr. Ransom. Thank you, Dr. Mannepalli, for highlighting Wakefield's fraudulent Lancet article that was published in 1998, and a retraction was published in 2010, and here we are in 2025 still dealing with the misinformation that hinders patients from making informed decisions.
Thank you.
If you're viewing online and have a question real quick, please put it into the Q&A section. Otherwise, in the room, comments or questions?
Yeah, my question is very simple. In I remember reading this back a long time ago, 82, 83, 84, something like that. It was 15 vaccinations by the time you were 28 years old. In today's world, you get 60 vaccinations at 30 years old. So I figure in 2050, you're going to be getting 500 vaccinations before you're 30 years old. You know what I mean? At this point in time. And the other thing that I'm thinking about, in the last 4 years, and I'm sorry to be political, but it's the truth, You have had over 20, 30 million people crossing the border. They have not been vetted. We don't know who's who. If you think of even malaria, Vivax in South America is not that bad. Falciparum in Africa, yes, it will kill you big time. And we've been importing all those people, we don't know who they are, so the mosquitoes can bite them and then they can transmit it to us. Even Chagas disease is being seen in the United States, which was, 20 years ago was unheard of. And even lower and parasitical infections are being seen here, which was never before. So, and we had a great leader like Fauci, which I love him, great leader. Fauci, who didn't know what the heck he was doing, when he said that 6 foot apart in the whole 9 yards. I don't know what to tell you.
I think when it comes to the vaccine schedules, the schedule is updated based on the evidence, how long the effectiveness of the vaccine stays, when you need a booster, whether if you even need a booster. And two, of course, like COVID, none of us expected that. But that's a new pathogen that we had to face 5-6 years ago now. So again, vaccine schedules are updated based on that. Again, what are the pathogens we need to target, the vaccine effectiveness, need for boosters. Anything else from the panel members? And I think if you look at the number of antigens, I think that's one of the things that per day, we are exposed to thousands of antigen versus the full vaccine schedule, we're exposed to 165, or if we look at the average, 150 to 170 antigens based on even the full vaccine schedule. So again, that's kind of where evidence is at this point. So anything else from the panel? No? Okay.
I do have a question. This is for Alex. When you spoke about RSV, the slide showed the CDC statement that it's not an annual vaccine, but yet it only provides protection for a year, possibly 2. So for a 75-year-old plus person, what should their schedule be for RSV?
Yeah, absolutely. Right now, it's still a one-and-done vaccination. There's 3 adult ones on the market right now. There's the mRNA product by Moderna, has 1 season of data out. There is the Pfizer product that has only published 1 season of data. And then there is the GSK product that's published 3 seasons of data. Looking at the 3 seasons of data, it's still about 60% efficacy, which is really good for a vaccine 3 years into use. So right now it's still recommended as one and done, but all of the manufacturers are still continuously following it and will make a recommendation of a boosters needed in the future. But right now with being out, it's only been out for 3 years, since 2023 was when it was approved in May. It still has good efficacy for right now. It could change in the future.
Okay, we have no questions online. One more for the audience. Okay.
Thank you for the presentation. It's awesome. I just wish you could compile this and publish it. There is so much misinformation out there. As you know, you face it every day. I see it every day. I look at YouTube and see all these YouTube doctors just going on and on, anti-vaccine, and then the people pick it up, and one by one, I get, it's a good way of dealing with it,
small
like
steps
you
at
do
a
in the
time, but
clinic,
continue to.
I
yes.
just wish you could publish it all and distribute it.
Actually, I have Henry here. One of the things we do is record these presentations that are shared on our CME site. And anyone can access, right, Henry? They don't need to have any passwords
Right.
And then Henry has helped us to get some social media feed as well to kind of publicize about this event. So hopefully it will reach more people. Thank you.